lips sweet surprise. Her hands are never cold. She's got Betty Davis eyes. She'll turn her music on you.
Welcome back to Vital Signs, along with Dr. Randy Tobler. I am Kelly Webb. And you know what? Quite frankly, I am having a ball with this morning. And more importantly...
it's just fantastic. This bumper music is awesome. It's great.
We are having a ball with our very own eye specialist, and that is Dr. Michael Jones of Illinois Eye Surgeons. Hi, Dr. Jones. Thanks so much for staying with us. We have so many calls for you.
I can't leave because I'm waiting for the next song.
I'm running, you know what? I'm running out of repertoire here. So,
all right.
The numbers are 969-9797 or 866-455-9797. Let's go right to Jan. Jan, you're on with Dr. Michael Jones. What's on your mind?
Hi, thanks for taking my call. I have an eye that has multiple problems. I had a detached retina many years ago, and I've got a buckle put around that, which has been stable all these years. Then I developed a couple years ago a corneal problem that they can't seem to either diagnose accurately. I see blurry out of that eye, that they can't, fix it with any prescription or everything. I also need cataract surgery. And another problem is that I'm allergic to lidocaine. And the cornea specialist told me that she could not do cataract surgery because I'm allergic to lidocaine and that there is nothing else. My dentist uses, and I know that I can take an alternative type of pain
anesthesia.
So I just wondered if you concur with that idea that that you can only use lidocaine in doing that surgery, or if there is another alternative that I could take.
Okay. Yeah, I mean, there are other numbing medicines we can use. I guess the question would be, are you allergic to all the types of canes or just lidocaine in particular? And if there was a real question, of course, you could do serum testing for that. But there are other numbing medicines we can use. I mean, we commonly use proparacaine and tetracaine. You don't have to use just lidocaine. So, once again, this shows you one of the advantages of the laser procedure. Sounds like she has a cloudy or hazy cornea, which would normally make the surgery very difficult for the surgeon. If she can't see out, he can't see in. Using the laser takes it out of the surgeon's hands. The laser is going to do it for us. And you don't require as much numbing medicine because the laser only takes about 40 seconds to run over the surface of the eye. So, again, I don't think it's something that's undoable. I definitely wouldn't say we can't do it just because you're allergic to lidocaine. We need to get to the bottom of that allergy, but there are definitely other medicines we can use to numb the eye. I wouldn't give up on it, yeah.
All right,
Cataract's not going away. I mean, we've got to do something about it.
All right, let's go to Sherry. We're trying to get you all on with one of the best, Dr. Michael Jones. Go ahead, Sherry.
Hi, thanks for taking my call. Listen, I just wanted to know, is there such a thing, does dry eye symptoms, my eyes feel kind of thick or gummy? I don't know if that accurately describes it. I don't have any particular vision problems. I wear glasses. I'm 60 years old, but my vision's fine, with reading glasses. But other than that, I don't think there's anything wrong. But they just seem from time to time, depending upon the more tired I am.
Absolutely.
They just seem to be kind of sick.
Yeah, I mean, we do thousands and thousands of surgeries a year here at Illinois Eye Surgeons, but one of the most common reasons come in to see us is for simple dryness on the surface of the eye. A dry eye is a significant problem. It's almost reaching epidemic proportions. It causes more pain and suffering per year than chest pain from angina, if you can believe that, Dr. Tobler. I mean, it's a significant problem, especially in people in her age group, females that are over the age of 60. And I know right before I came on, we were talking about nutrition. This is where nutrition can definitely play a role, specifically the good fatty acids, making sure you're taking flaxseed oil. Fish oils are very good for dry eye. And there are prescription-strength medicines you can go to, like Restasis, as an earlier patient mentioned. We're actually involved in an FDA clinical trial for the next generation of dry eye medicines. So if you've tried everything else and nothing's quite working for you, definitely make sure your diet's including those essential fats. And if that's not working for you, there are FDA trials you can get involved with to see what the next generation of dry eye medicine is going to do for you.
Oh, I have a question. What about Ocuvite? Does that help?
Yeah, well, not for dry eye, but, Ocuvite is based on a study that was done by the NIH at the early part of the decade, which shows that vitamin intake can significantly reduce the progression of dry macular degeneration. It was one of those things that showed something as simple as a multiple vitamin can greatly change your outcome. And Ocuvite is based on that study, and it's extremely important for patients who have early macular degeneration or a first-degree relative with macular degeneration.
Okay, good. Let's go to Sandra. Well, talking about macular degeneration, let's go ahead, Sandra. You're on with Dr. Michael Jones.
Yes, 2 questions. Mother at 80 had cataract surgery and now has watery eyes.
Mm-hmm. Yeah, and that's, again, extremely common and related to that dryness that's on the surface of the eye. When we make cuts into the eye to get the cataract out, it does cause a small scar from the incision. The scar from the laser procedure, the LensX, is smaller and tighter than the scar you'd get from a hand-cut incision. But in any event, you will still get some tearing and discomfort that can happen from time to time as the eye dries out. So lubrication is the key.
You're fading
You're telling
on
me her eyes are tearing, and I'm telling you to put more fluid on them, and it seems counterintuitive. But what happens is as that scar dries out on the surface of her eye, her brain just kicks in and starts making these watery tears, making the eye water. So we need to break that cycle by putting lubricant on the surface of the eye, keeping it moisturized.
Okay, Sandra, go ahead quickly with your macular degeneration.
Yes, brother-in-law was diagnosed with it. I know they used to wear these thick glasses. What's new now?
Probably the newest thing for macular degeneration for patients that are end-to-end stage, where we can't do anything else with, is an implantable telescope that's like those thick glasses you were talking about. All that does is provide an extreme amount of magnification that instead of having to be worn on the surface of the eye with glasses can actually be implanted inside the eye. These telescopes were just approved in late 2011, and you're going to start seeing them used more and more if the patient can tolerate them. Now, there's a series of tests that the patients have to go through first to determine whether they're a candidate, but that probably be the newest treatment that we have available for severe macular degeneration. The injectable medicines that we've been using for the last 5 years, my partner, Dr. Tom Fleming, uses a ton of this on his macular degeneration patients. These injectable medicines like Lucentis or Avastin have greatly changed how we treat bleeding macular degeneration. Those have been around for 5 years now, but they work wonders. So there are things we can do for it. You don't want to give up hope.
All right, doctor, we have one more call